And can you walk us through your journey or their journey for this company from a nascent company to something that much bigger right now? Do you have any insight about what happened, and so we can look to share with people what you could expect to experience and the steps that people can potentially have to go through to come into a more successful stage, to get to a more successful stage?
I mean, I can only admire people to have that stamina. I think don't expect anything easy being served to you. You know, our founder loves talking, talks about sort of having slept on the floor in the office, living out of the car for a while, really making sure that everything is running smoothly and working literally to the bone, right? I think that is something that comes with a lot of sacrifice. I think that's not easy, and it's admirable, but I would never recommend anyone to go into that if they want an easy solution or an easy life ahead of them. So yeah, that would be my number one thing. Listening to
This is not for the
our founder.
faint-hearted. This is not for the
Oh no.
faint-hearted. Yeah, this is not for the faint-hearted. And yes, please, what happened next?
No, I think with success, with that dedication, comes success, come clients, and comes the as with anything. I think you need to get to the point where you have validated and have verified that you're doing something right and you're doing something worthwhile, that people will want to join that mission, right? And when people want to join that mission and clients want to buy into that mission, that's when you know you're doing something worthwhile. And that's when things start taking off, but don't expect it to become easy at that stage, right? There's different challenges along the way all the time. So we 2 years ago had raised, the company had raised Series A to turn from what used to be professional services, so much like a consultancy, to more of a product-driven company, developing products and streamlining product development and optimizing product development, so that we can be more sound. But look, there's always challenges. I've only worked in small companies, but I've always worked with big companies, so there's always small company problems that are associated to running a business, right? And these challenges will only become more and more significant. When you're in healthcare, there is always a next frontier. There's always this next thing that is coming up. It could be, as we said at the start, right? Like, it could be that you're approaching a new stakeholder, you're trying to sell to a new stakeholder, you're trying a new user group to adopt your solution. All of this will bring its own challenges, right? Like, as soon as you try bridging across, it will become more challenging. I always like to say that healthcare is like I always react allergic to when somebody says, yeah, we're trying to fix healthcare as a startup, right? Because that is by default a bad goal. Like, anyone who would if you're looking to goal setting, like, that's the worst goal you can have. And I think that sort of mindset, if you have that, you try to go too broad too quickly. And I think the reality of these startups is you need to take incremental steps. You need to know where your technology and where your business is driving, but you need to have enough foresight to know where the industry is going, where the needs are going, and where you can actually make a difference. And I think that's the sort of balance you always have to strike, where you can go very badly wrong.
No, exactly. And fixing healthcare is, well, you can't fix healthcare, because if you say that, then I think you need 10 of you or a million of you to go into different aspects of healthcare to fix. There's so many aspects of healthcare to fix, and not to mention there's a different model in the US and Canada. It's different in the UK. It's different. So every place has their
Babylon.
own. Yeah. What happened to Babylon, right? What happened to Babylon?
Exactly.
Yeah.
No, I
my
mean,
God.
ask Babylon, right? Like, that's the number one lesson learned is it's difficult to expand. It's difficult to scale, right? Like, I mean, I've only read about it and listened to a lot of people talking about it. But the fundamental thing is, I think I always like to think of Babylon. Not that Babylon, I mean, it might have had its flaws, but fundamentally where it suffers is when you try to scale within healthcare and you try to go too broad within healthcare, not anticipating the challenges between, exactly what you said, between different systems, right? I think it was different systems in the UK sort of were scalable, and then you go into new health systems within the US, and not even within the US the systems are unified. So everything you do is not necessarily, there is no benefit of scalability, right? Like, what you would usually have is, like, every incremental health system you have needs to become cheaper at adding in and at using your service, if you cannot get there, and that's really difficult to get there, essentially every time you launch a new product and you launch a new product, so either it becomes incredibly difficult to manage or you will run out of funding just because that is expensive to run, and because if there is no volume benefits, then there is no benefit for you to go there.
Thanks for watching, and I appreciate you as a valuable viewer. And if you liked this segment, you can watch all of the different individual segments or the whole podcast to have a broader understanding on this topic. Just check the links in the description or what you see on the screen right now. I'm Dr. Umer Khan. Looking forward to seeing you again. Thank you.